Hi there. Here we are with our patient Cameron. Cameron had a procedure 10 days ago. We did a MaxHarvest procedure where we moved as much hair as we can move from the back to the frontal regions. How was the process for you, my friend?
It was great. Very easy. One procedure and back in 10 days, and it's looking better than ever.
Now, you've had a procedure before with us. And how did this process compare to the last process?
It was basically about the same process, very easy, not time consuming, and once I'm done, I'm basically looking good to go.
Now, did you have swelling? Did you have unusual amounts of pain? Anything like that happen to you?
For the second time around, no, basically the same as the first time. Not much different swelling, just a little bit in the front, but that was basically about it. I followed all the directions and it looked really good. So.
Okay, great. And so you feel you're ready to go back to work?
Oh yeah. Oh yeah.
Okay, great.
Oh yeah, I'm ready to go.
Alright, so anyways, what we did is we restored not only the frontal hairline and behind, we also blended in the temples. As you can see, it's healed really nicely with that. All the little scabs and crusts are already gone. As you can see on the other side here as well, virtually all gone. When we just kind of show the camera what happened up here, you can see he still has some scabs and crusts, but for the most part they're on their way out. You can see how they're just starting to flake their way off. That's the normal process. Those will all shed out, the hairs will fall out with it, and then that cell that's underneath there will grow the follicle in 3 to 4 months. When we do a MaxHarvest hair transplant procedure, what we always do is try to harvest as much hair as we can get from the donor area. Okay? What we're looking at here are the eyelets are above and below the suture line. The suture line, it would be this tiny little trace line. Okay? This is all shaved hair above and below. That's all going to come in. These little scabs are just going to slough off. Okay? That'll slough off, and then the hair is going to grow all above and below. All that disappears, and that'll be an undetectable suture line. So let's check it out the entire way around. So this is at 10 days. So if this is how this looks at 10 days, this will be completely gone in a year. It heals for up to a year. So over the next couple days, Cameron's going to just gently rub these little areas like this, and those little scabs are going to just flake off. And then this suture line running right here, that will be the suture line. And as you can see, it healed absolutely perfectly. So meanwhile, did you see your suture line yet?
Yeah.
Came out perfect. Completely undetectable. You excited?
I'm very excited.
Okay,
excited.
well
Thank
anyways,
you.
the procedure went absolutely perfect. I can always tell when my patients are great patients because everything's healed perfectly. The suture line's perfect, the top's perfect, that means he did everything he was supposed to do. I don't get these results without my patients being great patients and listening. So you did another great job, and you're going to have another great result.
I appreciate it.
Congratulations.
Thank you.